Okay, so I chose rubella, and rubella is caused by a virus, and it is carried by human reservoirs. There is no known transmission by insects or animals. It is characterized by the red rash you can see in the picture, and rubella usually occurs in children and young adults. Before the vaccine was developed, rubella epidemics would occur about every 6 to 9 years, and the most number of cases would be in the spring. Rubella is the leading vaccine-preventable cause of birth defects. Rubella is sometimes called German measles too, because it used to be considered a variant of measles, but then German literature was the first to consider it a separate disease. And it's also called 3-day measles sometimes because the rash usually lasts from 1 to 3 days. So rubella used to be considered part of the family Togaviridae, but then it moved to Matonaviridae recently. And its genus is rubivirus. So for the timeline, a person is first exposed when an infected person sneezes or coughs on them, so rubella is spread by person-to-person contact or through droplets from respiratory secretions. And then about a week later, the virus has spread throughout the body, and then 2 to 3 weeks later, symptoms start to appear. And when symptoms appear, the rash is normally the first sign, and this is when the person is most contagious, but they can still be contagious about a week before and a week after the rash. So for symptoms, about a quarter to a half of people won't have symptoms, but can still spread it to others, so kind of like COVID. But for the people that do have symptoms, in children, the symptoms are usually pretty mild, and they usually have a rash in 50 to 80% of cases, and this is a non-specific generalized rash. It's usually fainter than a measles rash and starts on the face and neck and moves down the rest of the person's body. This is usually the first sign, especially in younger children, and it lasts about 1 to 3 days. And older children usually have other symptoms such as these first. So these include a headache, a low fever, which is normally below 102, and nausea, mild conjunctivitis, or pink eye, like you can see up here in this picture. So that's like the redness or swelling of the white part of the eye. And they can have general discomfort, a cough, runny nose, and another characteristic sign is swollen lymph glands behind the ears and in the neck, like in the other picture. And in adults, the symptoms are usually pretty mild also. They can have a low fever, a sore throat, the same rash that children have, and then some get a headache, pink eye, and general discomfort before the rash. And about 70% of women develop arthritis and painful joints, mostly in their fingers, wrists, and then knees. And this is not usually chronic. It usually lasts about 3 to 10 days, and it's usually rare for men and children to have this symptom. Other rare symptoms include brain infections, brain bleeding, thrombocytopenic purpura, which occurs in about 1 in 3,000 people who have rubella, and this is a picture of that. So that's a decreased number of platelets in the blood, so that those that prevent bleeding. So this can be pretty serious. And then encephalitis, which is a swelling of the brain, occurs in about 1 in 6,000 people. So these are very rare, but can still be pretty serious. And so for rubella, there is no treatment. Usually the cases are pretty mild, but if the case is not mild, then you can rest and then control the fever with medicine, including acetaminophen. And if a parent is worried about their child's symptoms, it is suggested that they contact their child's doctor. So congenital rubella syndrome, this is the disease that the infant has when it is born because of the mother having had rubella while she was pregnant with a child. So for information, it was first reported in 1941. So Norman Gregg is an Australian ophthalmologist, and during a rubella epidemic in the 1940s, he discovered that there were lots of cataracts in babies of mothers who had rubella while they were pregnant. And so he reported this in 1941, and it was considered the first report of congenital rubella syndrome. And pregnant women who get rubella early in pregnancy have a 90% chance of passing it to their fetus. And passing the virus to their fetus can destroy fetal cells and disrupt cell division. The earlier in pregnancy that the woman gets rubella, the more serious the birth effects will normally be. Passing the virus to the baby can lead to miscarriage, fetal death or stillbirth, or death of the baby just after birth, or it can lead to CRS in the infant. So these are the symptoms of that. They can include hearing impairments, eye and heart defects, such as cataracts, liver or spleen damage, lifelong disabilities like autism, diabetes mellitus, and thyroid dysfunction, and these would require expensive care in the future also. So babies can also have low birth weight, a skin rash at birth, and then less common symptoms include glaucoma, brain damage, thyroid and other hormone problems, and inflammation of the lungs. And babies can shed the virus for up to a year and give rubella to other people, so they should be checked monthly for up to a year after they're 3 months old to see if they're still shedding the virus. So before the vaccine, 4 out of 1,000 babies born alive had CRS, and this doesn't even include the miscarriages that resulted of the mother getting rubella. There are still about 100,000 babies born with CRS each year, even though now we have an effective vaccine. It's the highest risk where the vaccine is hard to get, and women are able to and are having children. The highest risk is especially in the World Health Organization regions of Africa and Southeast Asia because they have the lowest vaccination coverage. And from 2005 to 2018, which was after Rubella was declared eliminated from the United States, only 15 babies have been reported having CRS in the United States for that whole time period. And then for diagnosis, PCR is usually the easiest and least expensive method to test for rubella. And the throat swab is normally, they say, the best specimen to gather. And then nasal swab and urine samples will also do for PCR testing. And these three specimens can also be used for molecular typing tests. And then to do serologic testing, you have to use a blood sample. So rubella is sometimes hard to diagnose, so clinical diagnosis is unreliable and shouldn't be used when assessing immune status. Up to half of infections may not be apparent, and many are not diagnosed because the rash of rubella looks like rashes of other illnesses. And people that are suspected of having rubella should be isolated, and that case should be reported to local health department. And for the vaccine, for the science of it, it's a live attenuated strain, meaning it has a live version of the virus to provide immunity, and a single dose gives a person more than 95% long-lasting immunity. It's a 2-dose vaccine, and they suggest that the first dose be given between 12 and 15 months of age, and the second dose between 4 and 6 years old. But the second dose has to be given at least 28 days after the first dose if this timing doesn't work out. And adults born on or after 1957 should get 1 dose of the vaccine, especially if they are a student in a post-high school education program, healthcare worker, international traveler, or a non-pregnant woman of childbearing age if they're not already immune. And the pregnant woman cannot receive vaccine, so they should be, if the woman does not have immunity, then she should be vaccinated after giving birth. So the vaccine is available in monovalent forms, but that's not allowed in the US. And then there's an MR vaccine, which is just measles and rubella. And then there is an MMR vaccine, which was approved in 1971. And this is the measles, mumps, and rubella vaccine. And then MMRV vaccine was approved in 2005, and this is measles, mumps, rubella, and varicella. So the side effects of the vaccine are usually very mild. There can be pain and redness at the injection site. They can have a low-grade fever and a rash and sometimes muscle aches. But mass immunization campaigns that included over 250 million adolescents found no serious reactions, so the vaccine is relatively safe and should be given. For timeline and elimination, the program to vaccinate began in 1969. Cases decreased dramatically, but they still tried to vaccinate more groups of people, and this included college students, military personnel, young women, and people in certain work settings, and this was to decrease rubella cases more. And this effort led to rubella being eliminated from the US in 2004 and from the WHO regions of the Americas in 2015. So eliminated is defined as the absence of continuous disease transmission for 12 months or more in a specific geographic region. So even though it's eliminated, it can still be brought to the US by other countries, and in 2013 through 2015, there are about 6 rubella cases each year, but all the evidence shows that the cases were brought from outside of the US. And throughout this time period, there were only 3 cases of CRS, so the vaccination worked. And then plans for the future, so more countries are using the vaccine now. There's almost 70% global coverage, and reported cases were down over 95% from 2000 to 2018. But it still circulates widely, especially in regions of Africa, Middle East, South, and Southeast Asia. Throughout the world, there are still more than 1,000 children born with CRS. Over 80% are born in Africa and some South and Southeast Asia countries. So in April 2012, the measles, and now rubella is part of that, so now it's the Measles and Rubella Initiative, they launched a global measles and rubella strategic plan. This gave global goals over 2012 to 2020. And then in 2018, though, the Global Vaccine Action Plan said that rubella control was still lacking. 26 countries hadn't introduced the vaccine yet, and 2 regions, Africa and Eastern Mediterranean regions, had no elimination of control targets. So then how to vaccinate more people? It only costs $2 to vaccinate against measles and rubella in developing countries. And then the statistic says that for every dollar spent, there's a $58 return. So vaccination doesn't appear to cost much in this statistic. I mean, $2 for everybody is still a lot, but vaccination is very doable, and it should be a goal for everyone in developing countries. And for the organization Gavi is one that supports this goal, and they work with the Measles and Rubella Initiative, which was mentioned before, and this helps countries introduce rubella vaccines. So they provided funding to low-income countries in 2012, and then 24 more countries started to use the vaccine. And they also support the vaccination of more than 450 million children in Indonesia and India. So overall, the disease is not usually very dangerous, but getting vaccinated is important in order to prevent the illness, and also it can be dangerous. There can be dangerous complications for some people, and then it also protects the unborn babies from CRS, which is usually very serious.